Is your blood pressure quietly rising because of the air you breathe at home?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster. Today we're looking at the evidence that filtering your indoor air can lower your blood pressure and reduce long-term cardiovascular strain, with a focus on what fine particulate matter does inside you and what practical steps actually reduce your exposure.
I'm Alara Sky. You spend most of your time indoors, and that's exactly where invisible pollutants accumulate. Fine particles and gases from traffic, industry, and common household sources. When you inhale PM 2.5, particles about 30 times thinner than a human hair, they penetrate deep into your lungs, enter your bloodstream, and contribute to cardiovascular disease.
Across large populations in North America, Europe, and Asia, every 10 micrograms per cubic meter increase in PM 2.5 has been linked to roughly a 6% rise in all-cause mortality and an 11% rise in cardiovascular mortality. Traffic-related exposures add to the problem. Elemental carbon from vehicles' tracks with similar mortality increases, and nitrogen dioxide raises cardiovascular mortality by about 5% per 10 micrograms per cubic meter.
If you've lived through smoky days, you've felt another source of risk. Wildfire smoke episodes have been associated with measurable blood pressure spikes, about 3.83 millimeters of mercury systolic and 2.36 millimeters of mercury diastolic after 4 or more smoky days in one Montana analysis. Because the particles infiltrate homes easily, staying inside without filtration doesn't fully protect you.
Mechanistically, PM 2.5 impairs your endothelial function, stiffening arteries and forcing your heart to push against higher resistance. Your immune system's reaction drives low-grade vascular inflammation that contributes to atherosclerosis, while oxidative stress destabilizes plaques and amplifies damage. In 2019 alone, PM 2.5 exposure was linked to 4.2 million global deaths, most from cardiovascular causes.
Now to the key question: can cleaning your indoor air make a measurable difference to your blood pressure? A large randomized crossover trial published in the Journal of the American College of Cardiology tested this directly in 154 adults living within 200 meters of major highways in eastern Massachusetts, areas with steady traffic pollution exposure.
Participants used identical-looking machines for 2-month-long phases, 1 month with active HEPA filtration, 1 month with sham filtration, separated by a washout. Units were placed in bedrooms and living rooms, ran nearly continuously, and windows and doors were kept closed during the trial. Neither participants nor researchers knew which units were active during each phase.
Where indoor air was monitored, HEPA units cut PM 2.5 by about 50% compared with sham devices over 24-hour periods. Baseline systolic blood pressure averaged 118.8 millimeters of mercury across the group, close to the threshold for elevated readings. The primary outcome was the difference in systolic pressure between HEPA and sham periods.
For participants starting at 120 millimeters of mercury or higher, HEPA filtration lowered systolic pressure by an average of 2.8 millimeters of mercury relative to baseline, while sham produced essentially no change, a slight 0.2 millimeters of mercury increase. That translated to a net 3.0 millimeters of mercury systolic reduction, attributable to filtration. Effects on diastolic pressure were not significant, and those with normal baseline systolic readings didn't show a change.
You might wonder whether a few millimeters of mercury matter. Prior meta-analyses indicate that a 2 to 3 millimeter of mercury reduction in systolic blood pressure corresponds to roughly a 6% to 9% lower risk of ischemic heart disease and a 4% to 6% lower risk of major cardiovascular events. Small individual shifts scale to large public health gains.
The researchers also emphasized feasibility. Unlike drug trials, this intervention fit normal living conditions. Their conclusion supported HEPA purifier use for vulnerable groups. people with elevated blood pressure or those living near high traffic corridors as a reasonable low-risk step to reduce cardiovascular risk through lower PM 2.5 exposure.
Your heart isn't the only organ affected. Long-term air pollution exposure is associated with more frequent and severe asthma, chronic bronchitis, and COPD progression. The International Agency for Research on Cancer classifies outdoor air pollution, especially fine particles, as a Group 1 carcinogen, with long-term exposure increasing lung cancer risk, even in non-smokers.
Pollution interacts with allergens to intensify symptoms by weakening airway barriers and magnifying immune responses. You may notice more nasal congestion, eye irritation, and breathing difficulty during high pollution periods if you're sensitive to pollen or mold. Elevated pollution also correlates with higher rates of infections like influenza and pneumonia, reflecting impaired airway defenses.
If you're pregnant or caring for children, pollution deserves special attention. Prenatal PM 2.5 exposure has been linked to low birth weight and preterm delivery, and in early childhood it can impair lung growth and reduce long-term lung capacity. There's also evidence of impacts on brain development, attention, and cognitive performance.
Neurologically, fine particles can cross the blood-brain barrier or travel along the olfactory nerve, triggering inflammation and oxidative stress in brain tissue. Long-term exposure has been linked to faster cognitive decline and higher risks of dementia, including Alzheimer's and Parkinson's disease. Metabolically, higher PM 2.5 exposure is associated with insulin resistance and increased likelihood of developing type 2 diabetes.
You can reduce exposure meaningfully at home. First, choose the right air filter. A high-quality HEPA purifier for your bedroom and main living area. If you want added protection, consider a unit with photocatalytic oxidation technology that uses ultraviolet light to break down pollutants rather than just trapping them.
Second, select safer cleaning and household products. Many conventional cleaners and fragranced items release volatile organic compounds that degrade indoor air. Swapping to baking soda, vinegar, and hydrogen peroxide, and skipping aerosols, air fresheners, and scented candles will reduce indoor chemical load.
Third, ventilate with care. Aim for at least 15 minutes of cross-ventilation daily to improve indoor air circulation. In your car, especially in heavy traffic, use the recirculate setting to reduce intake of polluted outside air. Newer vehicles off-gas volatile compounds, so airing them out regularly is also helpful.
Fourth, filter your water strategically. Municipal water commonly contains chlorine that vaporizes during showers and baths, contributing to airway irritation and fatigue. A whole house filter is ideal. If that's not possible, prioritize both drinking and shower water filtration to limit inhaled and dermal exposures.
Fifth, limit outdoor exposure during high pollution windows. Avoid exercising near busy roads and during rush hour when concentrations peak. Check your local air quality index and move workouts indoors when levels are elevated, especially during wildfire smoke events that drive intense, complex exposures.
If you live near major traffic or in a region prone to wildfire smoke, you can put this into action today. Place a certified HEPA unit in your bedroom, close windows during high AQI periods, and verify filter status regularly. Combine that with low VOC cleaning choices, smart ventilation, and targeted water filtration for a comprehensive exposure reduction plan.
Here's today's challenge. Check your local AQI, identify the room where you spend the most time, and set up a certified HEPA purifier there. Then audit your cleaning shelf and replace at least one fragranced or aerosol product with a simple alternative like vinegar or hydrogen peroxide. Monitor how you feel over the next 2 weeks and track your blood pressure if it's elevated.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.